So I just wanted to make a video of these reproductive models we have for lab exam purposes, because some of these labels, like this 18 for instance, on some of the keys is labia majora. This is not labia majora, this is the urinary bladder. So rather than writing on these things and making a new key, I just wanted to make a video where I did this so that we're all on the same page. Okay, let me start with the male reproductive system. Okay, here's the male reproductive system in sagittal view. This is really sort of where the reproductive tract begins. This is the testis. Okay, and this is the epididymis. This skin here is the scrotum. You'll notice that there are wrinkles in this skin. They're caused by a layer of smooth muscle here known as the dartos muscle. Okay, and this represents the spermatic cord. Okay, the structures in the spermatic cord: testicular artery, tympanoform plexus of veins, vas deferens, or ductus deferens, and as well there are nerves in this structure. There's the genital branch of the genitofemoral nerve. Superficial to the cord structures and to the cremaster muscle is the ilioinguinal nerve, which runs through the inguinal canal as well. Okay, this is the urinary bladder. Okay, the detrusor muscle is in the wall of this organ. I'll show you when I take the side off. This is the prostate gland. This is the seminal gland. This is the ureter. This is the ductus deferens, as it takes this winding path down to pierce and enter the prostate gland and form a common channel with the seminal glands and the other vas deferens and the urethra. Okay. This is sigmoid colon and rectum and anus. This is the internal and external anal sphincters. What else on this model? Let's see what's going on in this pelvis, if there's anything. Looking at this from above, this is the bladder. You see the big pelvic blood vessels. You see the posterior surface of rectus abdominis. And we can take this portion off and look on the inside of it, the medial side of it. This layer here represents the detrusor muscle. Okay, and this is the urethra. It's the urethra passing out. This urethra, as you'll notice, is enclosed and encased in this layer of kind of pink or red tissue. This is corpus spongiosum that has this distal expansion known as glands. This purple is corpora cavernosa. This is a bilateral structure. There's two, a right and a left. This is the pubic symphysis. This is the prostate gland. Okay, this shows that there are ducts that prostate gland utilizes to empty its secretions into the urethra. Okay. And here's a cross-section of the testis down here. There's a layer of cremaster muscle that surrounds the testis, and there's a dartos muscle that's in the wall of the scrotum. On this side, again, this is the detrusor muscle. Detrusor muscle contracts and expels the urine out of the bladder so long as the urinary sphincters are relaxed. Here's the prostate gland, urethra. Okay, here's the red corpus spongiosum. This one's gray over here. This represents corpora cavernosa. On the right, testis, cremaster, dartos, scrotum, skin. Here, I talked about that. What else? This side of the model shows the prepuce or foreskin, okay, around the glands. Okay. Female, when the model is intact, we're seeing here is an ovary. Okay, this red is the fimbria of the fallopian tube or the uterine tube. Okay, uterine tube comes down and joins this hollow muscular organ known as the uterus. Okay. So anterior to the uterus is urinary bladder. This is ureter coming in. This is the uterus and this is the vagina. This is the sigmoid colon and rectum. Okay, and coming out of the anus and distally, inferiorly. Okay, here's labia majora, labia minora. Down there's a right ovary, right fimbriae, right fallopian tubes coming into the uterus. This is the ureter coming down as it crosses over the iliac vessels to join the urinary bladder. Look at the inner part of this model, we have pubic symphysis, detrusor muscle in the bladder, urethra, myometrium and endometrium of the uterus, cervix, external os, vaginal canal or vagina, labia minora, rectum and anus, over here, pubic symphysis, bladder, detrusor muscle, urethra, myometrium, endometrium, hollow uterus. This is the uterus, cervix, cervical external os, here, vagina, labia minora, labia majora, sigmoid colon and rectum and anus. Okay, so pretty straightforward stuff there, you guys. But just wanted to make sure that, because you guys took pictures of these, and some of you are going to see, like, that's 18. I would call that detrusor muscle, or perhaps urinary, perhaps urothelium. The inner lining, the mucus epithelial, the epithelial lining of the bladder. But 18, I would definitely not call it labia majora, which is what's on some of these keys. So be aware. Be aware, be aware. I think you guys are going to be fine.